when we hear about firearm injuries or mass shooting events, they tend to be characterized by the number of people who died. And when there are data shown about the worst, for example, mass shootings in US history, those are also typically described by the number of people who died. But what's often forgotten, I think, in those cases is the number of people who also were hurt by firearms in those incidents, but managed to survive. And what are the health and economic consequences of those non-fatal injuries? So in this study design, we looked at 1 year prior to firearm injury through 1 year after firearm injury. And we found that non-fatal firearm injuries led to a roughly fourfold increase in healthcare spending in the first year after the non-fatal firearm event. This fourfold increase in healthcare spending was explained by increases in every category of healthcare spending we looked at, including hospitalizations, outpatient visits, prescription drugs, labs, imaging, tests, home care, transportation, and others. We found that on average, over the first year following a non-fatal firearm injury, survivors experienced about a $30,000 increase in total healthcare spending across that year. When we multiplied $30,000 per survivor by the roughly 85,000 non-fatal firearm injury survivors each year in the US, that came out to be about $2.5 billion in total direct healthcare spending, attributable plausibly to non-fatal firearm injuries in the first year alone. Of that $2.5 billion in direct medical spending in the first year, about 96% of those dollars were paid by public payers like Medicare, private payers like insurance plans, or employers who are effectively self-insured, with about 4% paid by patients out of pocket. And so the vast majority of those dollars are paid by either taxpayers in one way or another, or through wages foregone from the workforce through employer healthcare spending. So the number of people who are injured in a non-fatal fashion through firearms is quite large. And I think intuitively, as members of the public, when they are not talked about as much in the coverage of these events, we tend to think that they were okay because they survived. Every innocent life lost in these mass shootings is a tragedy. And remembering the lives lost helps us honor them and cement their legacies into our memory. At the same time, this study shows that the impact on the many other lives injured is profound, both clinically and economically, with ripple effects from survivors through family members and extending to employers and payers.